All are indications. Good evening, guys. Today we are going to do anesthesia. All are the indications for one lung ventilation except A. Bronchopleural fistula, B. Massive hemorrhage in one lung, C. Video assisted thoracoscopy, and D. Cardiac surgery. Now, what do you think is the correct answer here? Is it bronchopleural fistula, massive hemorrhage in one lung, video assisted thoracoscopy, or cardiac surgery? What do you think is the correct answer? It is cardiac surgery. All are the benefits of supraglottic airway device over endotracheal tube. It is less invasive. It causes less hemodynamic alteration. It prevents aspiration. It requires less time for insertion, except it prevents aspiration. The most frequently reported malfunction in medical gas pipeline system is A. Inadequate pressure, B. Cross connection, C. Excessive pressure, D. Alarm dysfunction. It is inadequate pressure. Color of the shoulder of oxygen cylinder is A. White, B. Black, C. Blue, D. Yellow. It is white. Massive transfusion of stored blood relates in A. Citric acid toxicity, B. Hypokalemia, C. Metabolic acidosis, D. Hypercalcemia. It is citric acid toxicity. Gene for ryanodine receptor mutation which is responsible for malignant hypothermia is located on which chromosome? A. Chromosome 19, B. Chromosome 17, C. Chromosome 18, D. Chromosome 16. It is chromosome 19. First sign of accidental intraarterial injection of drug is A. Pain, B. Pallor, C. Cyanosis, D. Cording. It is pallor. Highest concentration of oxygen is delivered through A. Nasal cannula, B. Venturi mask, C. Bag and mask, D. Mask with reservoir. It is bag and mask. Highest concentration of oxygen is delivered. A 20-year-old man was running on the road. He suddenly collapsed. First thing to do is A. Check pulse, B. Chest compression, C. Call for help, D. Scene safety. It is scene safety. First of all, you have to look for the scene safety, whether it is safe or not. A patient with stable atrial fibrillation, what should be started? A. IV ibutylate, B. Immediate cardioversion, C. Amiodarone, D. Sotalol. It is IV ibutylate. Where should you attempt to perform a pulse check in a child who is anywhere from 1 year to puberty? A. Carotid artery, B. Carotid or femoral artery, C. Radial artery, D. Femoral artery. It is carotid or femoral artery. Depth of anesthesia can be best assessed by A. Pulse oximeter, B. End-tidal carbon dioxide, end-tidal PCO2, ABG analysis, bispectral index. It is bispectral index. Depth of anesthesia can be best assessed by bispectral index. Most commonly used nerve for neuromuscular monitoring under anesthesia is A. Radial, B. Ulnar, C. Glossopharyngeal, D. Venous. What do you think is the correct answer here? For neuromuscular monitoring under anesthesia, you use the ulnar nerve. Best site for core temperature monitoring during malignant hyperthermia is A. Oral, B. Esophagus, C. Axillary, D. Rectal. It is esophagus. The esophagus is the best site for core temperature monitoring during malignant hyperthermia. The following are methods of invasive cardiac monitoring. A. Radial artery cannulation, B. Pulmonary artery catheterization, C. Transesophageal echocardiography, transthoracic echocardiography, except transthoracic echocardiography. Ashner reflex is seen in A. Cardiac surgery, B. Neurosurgery, C. Spinal anesthesia, D. Squint surgery. It is squint surgery. All are indications of evoked potential monitoring. A. Cerebrotomal resection, B. Brachial plexus repair, C. Mastoid surgery, spinal fusion. It is MAST heart surgery. A heavy smoker, when posted for elective surgery, would be benefited for if he stops smoking. A 3 to 4 days before surgery. B 1 to 2 weeks before surgery. C 2 to 4 weeks before surgery. D 6 to 8 weeks before surgery. It is 6 to 8 weeks before surgery. During pulmonary artery catheterization, entry into pulmonary artery is denoted by A increase in systolic pressure, B decrease in systolic pressure, C increase in diastolic pressure, D decrease in diastolic pressure. It is increase in diastolic pressure. The most common complication of pulmonary artery catheterization is A infection, B thromboembolism, C arrhythmia, D pulmonary artery rupture. It is arrhythmia. The most common complication of pulmonary artery, when you do pulmonary artery catheterization, the most common complication is arrhythmia. Which among the following is best monitored to detect abnormal hemoglobins? A pulse oximeter, B SIVO oximeter, C capnography, D spirometer. It is SIVO oximeter. Plasma cholinesterase is reduced in all of the following: A pregnancy, liver disease, malnutrition, hemolysis. It is hemolysis. Which of the following is not a complication of succinylcholine? A increased IOP, B increased ICP, C increased BP, decreased heart rate. It is increased BP. Water content of soda lime is A 0%, B 5%, C 10%, D 15%. It is D 15%.